Hey there, and welcome to our video on iron supplements for anemia. In this video, we'll be diving deep into the world of iron deficiency anemia and how iron supplements can help restore your iron levels and vitality. We'll cover the various types of iron supplements available, their dosage and administration, efficacy and safety, and special considerations for specific populations. By the end of this video, you'll have a comprehensive understanding of how iron supplements can help you combat anemia and regain your energy and well-being. So, let's get started. Iron deficiency anemia is a prevalent nutritional disorder that affects a significant portion of the global population, particularly women, children, and individuals with certain health conditions. A study by Levi and colleagues, published in the European Journal of Haematology in 2016, found that iron deficiency anemia is a common problem in primary care settings across 4 European countries. Iron supplements are the primary treatment for this condition, aiming to replenish iron stores and stimulate the production of red blood cells, a process known as erythropoiesis. Iron is an essential mineral that plays a crucial role in the formation of hemoglobin, a protein in red blood cells that carries oxygen throughout the body. When iron levels are insufficient, the body struggles to produce enough healthy red blood cells, leading to anemia and its associated symptoms, such as fatigue, weakness, and shortness of breath. The importance of iron supplements in treating iron deficiency anemia cannot be overstated. By restoring iron levels, these supplements enable the body to produce more red blood cells, thereby improving oxygen delivery to tissues and organs. Let's talk about the different types of iron supplements available. Oral iron supplements are the most common and readily available form of iron supplementation for treating iron deficiency anemia. The most frequently used oral iron formulations include ferrous sulfate, ferrous gluconate, ferrous fumarate, and ferric citrate. These supplements vary in their elemental iron content, which refers to the amount of iron available for absorption by the body. Ferrous sulfate is the most widely used oral iron supplement due to its high elemental iron content and low cost. It is available in various forms, such as tablets, capsules, and liquid solutions. Ferrous gluconate and ferrous fumarate are also effective oral iron supplements, although they have slightly lower elemental iron content compared to ferrous sulfate. Ferric citrate, a newer oral iron formulation, has been shown to be effective in treating iron deficiency anemia in patients with chronic kidney disease. A study by Fishbane and colleagues, published in the Journal of the American Society of Nephrology in 2017, demonstrated that ferric citrate significantly improved hemoglobin levels and iron stores in patients with non-dialysis-dependent chronic kidney disease and iron deficiency anemia. This formulation has the added benefit of acting as a phosphate binder, which is particularly useful in managing hyperphosphatemia in patients with chronic kidney disease. In 2019, the U.S. Food and Drug Administration, FDA, approved a novel oral iron supplement called ferric maltol, Acrufa, for the treatment of iron deficiency anemia in adults. A Phase 3 clinical trial program by Gash and colleagues, published in Inflammatory Bowel Diseases in 2015, showed that ferric maltol was effective in improving hemoglobin levels and replenishing iron stores in patients with inflammatory bowel disease. Now let's move on to intravenous IV iron supplements. IV iron is used when oral iron supplementation is ineffective, poorly tolerated, or contraindicated. It is particularly beneficial for patients with chronic conditions, such as chronic kidney disease, inflammatory bowel disease, and heart failure, where iron deficiency anemia is common and oral iron may not be sufficient. Several IV iron formulations are available, including ferric carboxymaltose, Injectafer, ferromoxitol, Ferraheme, ferric derosamaltose, monoferric, and iron sucrose, Venofer. These formulations differ in their dosing regimens, administration times, and safety profiles. A recent study by Wolf and colleagues, published in the American Journal of Haematology in 2021, compared the safety of ferric derosamaltose and iron sucrose in patients with iron deficiency anemia. The authors found that both formulations had a favorable safety profile, with ferric derosamaltose allowing for higher doses of iron to be administered in a single session, reducing the number of infusions required. I4 iron supplementation has been shown to be more effective than oral iron in rapidly increasing hemoglobin levels and replenishing iron stores in patients with iron deficiency anemia. The CONFIRM-HF trial, a large randomized controlled study published in the European Heart Journal in 2015, demonstrated the efficacy and safety of long-term IV iron therapy with ferric carboxymaltose in patients with heart failure and iron deficiency. The study, led by Ponikoski and colleagues, showed that ferric carboxymaltose significantly improved functional capacity, quality of life, and reduced the risk of hospitalization in these patients. However, it's important to note that IV iron also carries a higher risk of adverse reactions, such as infusion reactions and anaphylaxis, which requires close monitoring and management. A review by Kalra and Bandari, published in Current Opinion in Nephrology and Hypertension in 2016, discussed the safety of IV iron use in chronic kidney disease and highlighted the importance of careful patient selection and monitoring to minimize the risk of adverse events. Now let's discuss the dosage and administration of iron supplements. The recommended dietary allowance, RDA for iron, varies by age, sex, and pregnancy status. According to the National Institutes of Health, the RDA for adult men and postmenopausal women is 8 mg per day, while for premenopausal women, it is 18 mg per day. Pregnant women require a higher iron intake, with an RDA of 27 mg per day. Oral iron supplements typically contain between 60 and 325 mg of elemental iron per dose. However, lower doses of oral iron have been shown to be equally effective in treating iron deficiency anemia, while causing fewer gastrointestinal side effects. A study by Moretti and colleagues, published in Blood in 2015, found that a daily dose of 60 mg of elemental iron was as effective as higher doses in improving hemoglobin levels and iron stores in iron-depleted women. Alternate day dosing of oral iron supplements has been proposed as a strategy to improve iron absorption and reduce gastrointestinal side effects. A study by Stoffel and colleagues, published in Hematologica in 2020, demonstrated that alternate day dosing of oral iron resulted in higher iron absorption compared to daily dosing in iron-deficient anemic women. This finding suggests that alternate day dosing may be a more efficient approach to oral iron supplementation. IV iron dosing depends on the specific formulation used and the patient's body weight and iron deficit. For example, ferric carboxymaltose can be administered as a single dose of up to 1,000 mg of iron, while iron sucrose requires multiple smaller doses of 200 to 300 mg of iron. The dosing regimen for IV iron should be individualized based on the patient's clinical condition and response to treatment. Now, let's talk about the efficacy and safety of iron supplements. Oral and IV iron supplements have been shown to be effective in treating iron deficiency anemia, but their efficacy and safety profiles differ. A meta-analysis by Occam and colleagues, published in the American Journal of Medicine in 2016, compared the efficacy of oral and IV iron in treating iron deficiency anemia, and found that IV iron resulted in a more rapid and pronounced increase in hemoglobin levels compared to oral iron. However, the authors noted that the long-term efficacy of oral and IV iron was similar. While oral iron supplements are generally well tolerated, they can cause gastrointestinal side effects such as nausea, vomiting, diarrhea, and constipation. These side effects can lead to non-compliance and inadequate iron absorption. IV iron, on the other hand, bypasses the gastrointestinal tract and is associated with fewer gastrointestinal side effects. However, IV iron carries a risk of infusion reactions, which can range from mild symptoms such as itching and flushing to severe anaphylactic reactions. The risk of infusion reactions varies among different IV iron formulations, with ferric derazomaltose and iron sucrose having a lower risk compared to ferric carboxymaltose and ferromoxytol. A study by Koutrabakis and colleagues, published in Digestive Diseases and Sciences in 2010, evaluated the safety and efficacy of total dose infusion of low molecular weight iron dextran for iron deficiency anemia in patients with inflammatory bowel disease. The authors found that this approach was safe and effective in correcting anemia and replenishing iron stores in these patients. Now, let's discuss some special populations that may require specific considerations when it comes to iron supplementation. First, let's talk about pregnancy. Iron deficiency anemia is common during pregnancy due to the increased iron demands of the growing fetus and placenta. Maternal iron deficiency anemia is associated with adverse pregnancy outcomes, such as low birth weight, preterm delivery, and increased risk of maternal and neonatal mortality. The Centers for Disease Control and Prevention, CDC, recommends that all pregnant women receive a daily oral iron supplement of 30 to 60 milligrams of elemental iron to prevent iron deficiency anemia. For pregnant women diagnosed with iron deficiency anemia, higher doses of oral iron or IV iron may be necessary to correct the anemia and replenish iron stores. A study by Bryman and colleagues, published in the Archives of Gynecology and Obstetrics in 2017, compared the efficacy and safety of IV ferric carboxymaltose with oral ferrous sulfate in pregnant women with iron deficiency anemia. The authors found that ferric carboxymaltose was more effective than oral iron in improving hemoglobin levels and iron stores with a better tolerability profile. Next, let's discuss chronic kidney disease, CKD. Iron deficiency is a common complication of CKD and contributes to the development of anemia in this population. The prevalence of iron deficiency in CKD patients ranges from 24% to 85%, depending on the stage of CKD and the diagnostic criteria used. Both oral and IV iron supplements are used to manage iron deficiency anemia in CKD patients. However, the efficacy of oral iron may be limited in this population due to impaired iron absorption, increased hepcidin levels, and the presence of inflammation. IV iron has been shown to be more effective than oral iron in treating iron deficiency anemia in CKD patients. Lastly, let's talk about inflammatory bowel disease, IBD. Iron deficiency anemia is a common extraintestinal manifestation of IBD, affecting up to 70% of patients with IBD. The pathogenesis of iron deficiency anemia in IBD is multifactorial and includes chronic blood loss, impaired iron absorption, and the presence of inflammation. IV iron is the preferred route of iron supplementation in IBD patients due to its better tolerance and efficacy compared to oral iron. Oral iron may exacerbate gastrointestinal symptoms and increase inflammation in IBD patients. A Phase 3 clinical trial program by Gashche and colleagues, published in Inflammatory Bowel Diseases in 2015, evaluated the efficacy and safety of ferric maltol in correcting iron deficiency anemia in patients with IBD. The authors found that ferric maltol was effective in improving hemoglobin levels and iron stores, with a favorable safety profile. Monitoring response to iron supplementation is crucial to ensure the effectiveness of treatment and to detect any adverse reactions. Hemoglobin, ferritin, and transferrin saturation are the key parameters used to assess iron status and response to iron therapy. Hemoglobin levels should be monitored periodically during iron supplementation to evaluate the improvement in anemia. Ferritin, a marker of iron stores, and transferrin saturation, an indicator of iron availability for erythropoiesis, should also be measured to assess the adequacy of iron supplementation. Treatment should be adjusted based on the patient's response to iron supplementation. If the patient does not respond adequately to oral iron, a switch to IV iron may be necessary. Similarly, if the patient experiences adverse reactions to a particular iron formulation, an alternative formulation should be considered. In addition to monitoring response to iron supplementation, it is essential to evaluate and address the underlying causes of iron deficiency anemia. This may include investigating sources of blood loss, such as gastrointestinal bleeding or heavy menstrual bleeding, and assessing for malabsorption disorders. The American Gastroenterological Association, AGA, recently published clinical practice guidelines on the gastrointestinal evaluation of iron deficiency anemia. The guidelines, authored by Coe and colleagues and published in Gastroenterology in 2020, recommend that adult patients with iron deficiency anemia undergo upper and lower gastrointestinal endoscopy to evaluate for potential sources of blood loss and malabsorption. In conclusion, iron supplements play a vital role in treating iron deficiency anemia, a prevalent nutritional disorder that affects a significant portion of the global population. By replenishing iron stores and stimulating erythropoiesis, these supplements enable the body to produce more healthy red blood cells, thereby improving oxygen delivery to tissues and organs. The various oral and intravenous iron formulations available offer healthcare professionals and patients a range of options to suit individual needs and preferences. Tailoring the dosage, route of administration, and monitoring to the patient's specific requirements and underlying conditions is essential for optimal outcomes. Factors such as age, sex, pregnancy status, and the presence of chronic diseases like chronic kidney disease and inflammatory bowel disease should be considered when selecting the most appropriate iron supplement and dosing regimen. Regular monitoring of hemoglobin, ferritin, and transferrin saturation levels is crucial to assess the response to treatment and make necessary adjustments. Effective management of iron deficiency anemia requires collaboration among healthcare professionals, including primary care physicians, hematologists, gastroenterologists, and obstetricians. A comprehensive approach that includes proper diagnosis, treatment, and follow-up is essential to ensure the best possible outcomes for patients. By addressing the underlying causes of iron deficiency, such as blood loss or malabsorption, and providing appropriate iron supplementation, healthcare professionals can help patients restore their iron levels, alleviate anemia symptoms, and improve their overall quality of life. And that wraps up our in-depth look at iron supplements for anemia. We hope you found this information helpful and informative. If you'd like to learn more about iron supplements and other nutritional topics, be sure to visit nutritionmarket.com.au. There, you'll find a wealth of resources and information, as well as the opportunity to purchase high-quality supplements to support your health and well-being. At nutritionmarket.com.au, we also offer a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. If you're interested in receiving personalized guidance and support for your nutritional needs, consider booking a consultation today. Before we go, we want to remind you that while the information provided in this video is based on scientific research, it should not be considered a substitute for professional medical advice. Always consult with your healthcare provider before starting any new supplement regimen or making changes to your diet and lifestyle. If you found this video helpful, please hit the like button and subscribe to our channel for more content like this. Your support helps us continue to create informative and engaging videos on a wide range of health and nutrition topics. Thanks for watching, and we'll see you next time.